Hi, good afternoon, everyone. Welcome to the MGFA's Wellness Series webinar. Today's presentation is Spend Your Spoons Wisely, Energy Conservation and Pacing for Success with Myasthenia Gravis with Dr. Liz Plowman. Before we get started, I'd like to welcome everybody here today, and I just want to go over a couple of things. Today's session is recorded, and if you have any questions, you can type them in the Q&A box at the bottom of the Zoom page. I'd like to thank our presenting sponsors, Alexion Argenix, Amgen, UCB, and Janssen. And thank you all once again for presenting or for joining us for the presentation. With that said, Dr. Plowman, I'm going to hand it over to you.
Thank you so much, and thank you for having me. It's an absolute honor to be here today. Let me go ahead and share my screen so we can get going here. Right. Jenna, is my title slide showing?
Yep, we can see it.
All right, perfect. Thank you. As Jenna said, the title of today's presentation is Spend Your Spoons Wisely. It is all about energy conservation and pacing for success with MG. And I am Dr. Liz Plowman. A little bit about me. So I am known on the internet. My internet moniker is the Myasthenic PT. The reason for that is I am both a PT and a person living with myasthenia gravis. I have a doctorate in physical therapy from Texas Women's University. I also have a residency and board certification in orthopedics. I have a fellowship in pain neuroscience, and I have done postdoctoral study at Texas Tech University specific to myasthenia gravis. As I said, I'm a person living with MG, so I both see this condition from the personal and the professional side. So that is why I'm coming to you today. I'm also the author of Some Spoons Are Worth Spending. It's a book all about energy conservation for people living with myasthenia gravis. I'm an MG educator and advocate. I'm U.S. Navy retired. I was a physical therapist in the United States Navy, and I medically retired due to myasthenia. So a little bit about that and me and how myasthenia has been part of my journey. So when I started as a physical therapist in the Navy, I was a very staunch orthopedic physical therapist. I wanted absolutely nothing to do with the neurologic conditions. They were just not what got me excited in the morning. And then the universe had a really good sense of humor or bad sense of humor, depending on your point of view, and slapped me with a neurologic diagnosis. So I did what any of us do. I Googled it. And I flipped back through my notes from PT school, my half of a PowerPoint slide that I had at one point in a neurologic lecture. And to learn about myasthenia, it completely changed my career as a physical therapist, as a naval officer. It did lead to my medical retirement from the Navy, but I will say I'm a firm believer in silver linings and blooming where you're planted. And having myasthenia has made me a far more compassionate, empathetic provider, and it shifted me from orthopedics to the neurologic side of physical therapy. And I really embraced this population and working with folks with MG because I feel like we are a very underserved population. So that's a bit about my journey with myasthenia, my professional journey with it. I am married. I have an absolutely wonderful and supportive spouse, and we have kids and dogs who think they're kids. So I have a house full of kids. And then aside from professional life and aside from myasthenia, I'm also an entrepreneur. I learned when I was 12 years old, I learned that other people would pay me to wash their cars, and it kind of went from there. So I've always been an entrepreneur at heart. I'm a travel enthusiast. I am a foodie. I am so I write professionally. I'm an editor for a magazine, but I also write on the personal side. It's a passion of mine. So I am a nighttime novelist. I am a big Star Trek fan, and I am a mild coffee addict. So that's just a little bit about me. I do have two disclosures to share, and I do this for full transparency. So I do own a company that that treats and consults for people with myasthenia gravis, and it is a for-profit company. So I do want to disclose that up front. And I am, as I said, the author of Some Spoons Are Worth Spending. It is book available. I put that up here just because those are commercial enterprises for me, but if I do reference them, I'm not trying to market or self-promote or recruit. I'm here purely for education purposes. And I put these up here simply to kind of demonstrate my credentials and expertise and qualifications for giving this talk today. All right, our roadmap for today's discussion. So first, we're going to talk about why energy conservation is important, both from a physical side and then also from a kind of a mental and spiritual side. I'm going to talk about different frameworks for energy budgeting and how to think about that. So some you've heard and maybe some you haven't. We're going to talk about avoiding energy overdraft. And then we're going to talk about energy conservation and pacing strategies. And then hopefully we have some time left and I will take questions. So why energy conservation? My daughter brought home a worksheet from school, and it had her list her needs and her wants, and to learn the difference between the two of them. So, right, needs, food, water, shelter, oxygen, that sort of thing. And then wants, right, her, what electronic device or what books or what favorite foods or things like that she wanted. And she had to group them. And I really liked that. And we have to think about that too, right? What are our needs? What are the things we need to do? What are the things that have to get done? And then what are the things we want to do? What are the activities that we enjoy engaging in, but maybe are not a necessity? So again, why energy conservation? Well, at its heart, myasthenia gravis is a energy limiting disorder. And I'm not, for the sake of this presentation, I am not going to go into the in-depth pathophysiology of why it's an energy limiting disorder. There are plenty of resources and folks who are a lot more qualified than I to share that information. But if you are listening to this presentation, either live or on the replay, you probably know a thing or two about myasthenia gravis already. So I'm going to just kind of go from that point. But right, it is an energy limiting disorder. Right? We have myasthenia gravis is a fatigable condition. So if you do too much activity, muscles fatigue, and you have to limit the amount of activity you do. And compared to people who don't have a condition like myasthenia that requires them to conserve energy, the folks who don't have that condition don't necessarily have to think about budgeting their energy. They don't think about having to energy conserve, whereas we have a limited amount of energy that we can spend, so we have to think about it. So that brings us to thinking about, right, the activities that we have to do, the activities that must get done. So we have to have some level of hygiene. We have to feed ourselves. We have to generate some sort of an income, whatever that looks like. There are things that we have to do activity-wise, and then there are the activities that we want to do, the things that give us meaning. So the idea with energy conservation is that we can limit the amount of energy that is spent on those activities we have to do, and to have more energy left over to spend on the activities that we want to do. And there's a story that it sticks with me. It was my family doc, my family physician, and I was asking him to sign the paperwork for me to have a handicap placard. And this was early in the diagnosis. I had just started using a cane, and it took a lot for me to do that. But then I realized, oh my gosh, I start walking with a cane, and I can walk further, I can do more, I can enjoy these activities more. So I bought into it. But I asked him to sign the paperwork for a placard. And my daughter, who was 14 months old at the time, was there with me. And she's, sitting on the floor playing with Tupperware, as a 14-month-old does. And he asked me the question, the typical questions for the questionnaire. And I said, oh, doc, I won't use it unless I really have to, unless I'm really symptomatic. I just need it if I'm feeling really bad. And he looked at me and he said, Liz, let me ask you something. Would you rather spend your energy on playing with your daughter or walking across the parking lot? Choose one. And I said, okay, point taken. He said, I want you to use it even if you're feeling good. Save the energy you have for the things that are important and that you want to do. So that is something that it continues to stick with me when I think about energy conservation. So energy budgeting framework. So different ways to think about it. Most of us have probably heard of the spoon theory. If you haven't, the spoon theory was coined by, and I do apologize if I butcher her name, Christine Miserandino. It was coined in 2003, and it was basically a way, the way the story goes is that she was trying to describe to a friend of hers the concept of energy conservation. And I don't know if the story is true or not, but either way, it's a good story. That she was sitting in a diner and she grabbed a handful of spoons from a central station, put them on the table, and said, okay, imagine I've got 12 spoons to spend for the day. I get out of bed, that cost me one. She pulled the spoon away. I got to take a shower, that cost me two. I've got to go to work, that cost me five. And she kept doing that right until she had two spoons left. And she said, okay, it's noon. I have two spoons left. How do I spend them? And the idea was to conceptualize the idea that I have a finite amount of energy to spend, particularly as someone living with a chronic illness that requires me to conserve my energy. So that's the spoon theory in a nutshell there. So basically you have a budget of spoons to last you the day. Each activity you need or want to do costs a certain amount of spoons. How do you spend them? How do you budget it? I like the spoon theory, but there are some inherent difficulties to the spoon theory. One is that it's very hard to conceptualize energy as spoons because I don't have any other framework for conceptualizing spoons. The other thing is that, I'm looking at the diagram, the one that's on the graphic that's on the slide right now. And so work, for example, work says it costs 5 spoons. Well, that's very variable. It depends on what I do for work. If I have a very manual labor type job, a very physically intensive job, I think that's going to cost a lot more than if I have a more administrative, indoor, air conditioned, sedentary type job. So I think some of these are a little hard to conceptualize. Also, I think it's important that the budget of spoons for the day, especially for someone living with a condition like MG, is a moving target. So one day you might have 15, one day you might have 12, one day you might have 18, one day you might have 5. And it's a little bit different every single day. And so that's a little bit hard to use the spoon theory when it is an absolute moving target. Another way to think about it that might be a little bit easier to conceptualize is money. So financial budgeting. Every single one of us has had to manage some sort of a budget, whether that's a personal bank account or a large company or anywhere in between. So I like financial budgeting a little bit better because it relates to a framework that we deal with every single day. So imagine, right, you have $100 to spend in a day. I might need to adjust that number for inflation, but we're going to go with 100 because it's nice and easy and even. And you have to budget out your day. And the idea is that you want to budget without overdrawing your account at the end of the day. Now, and I'm sure we've all been there, that there are days that you push past your energy reserves, that you do too much, that you overdo it. And so I think of that as charging to my credit card or going into my overdraft limit. But the problem with that is that you can maybe do it once and then pay it back. But if you make it a habit, right, that bill is going to come due with interest. And that looks like being knocked out for 2 or 3 days. So I like the financial budget idea. But again, because it's easier to conceptualize, but again, right, moving target. So another way I like to think about it, and I think this is something that we can all relate to, and it's a little more closer to the actual concept of energy, would be the cell phone battery. So every single, or I would say almost every single one of us has the electronic device. We use it on a daily basis. I'm sure a lot of people are actually watching this presentation on such a device right now. And they are pretty ubiquitous in our world right now. So the concept of battery life is that you have activities that are going to drain your battery at different rates. So for example, on the phone, a video chat is going to drain your battery faster. It's going to cost more energy than a telephone call, which will drain more energy than a text message. So if you are running on a low battery and someone tries to video call you, it's very easy to say, nope, I'm going to decline that call. Battery low, please text. So that's just something that we can relate to, and that relates to energy. So different activities are going to drain your battery at a different rate. The idea is to stay out of the red, right? And then also, did you start your day at a full charge? Or is it the kind of day that you plugged your phone in overnight and it maybe got to 60% and then stopped? Or it didn't charge at all. Maybe the phone, the charger came unplugged or something. And then you wake up and you say, oh my gosh, it's at 20%. Okay, then you start budgeting what you're doing on your phone. You might put it into battery saver mode, and which reduces the amount of battery that those activities take from your phone. Are you periodically stopping to recharge your phone? So that's why I'm mentally moving more to a framework of thinking of a cell phone battery when I start thinking about energy conservation, because I think it's a lot easier to conceptualize. And the point is, we want to avoid energy overdraft. And I know we've all done it. I've done it more times than I probably care to admit, but we want to avoid that. And it's important to recognize what the signs are of energy overdraft. And they look different for everyone. So that's really important to know your own body and to know what your signs look like. So this might look like increase in muscle weakness, increase in overall fatigue. You might feel like you're dragging a little bit more. This might be vision changes. You might have if you normally have maybe a little bit of double vision, your vision might, the doubling might get more severe. Or you might notice your ptosis, the eyelid drooping, get a little bit worse. You might have a little change in some difficulty breathing. Now, I do say that with the caveat that if you have significant breathing issues, that's an emergency situation. That is a sign of an impending crisis, and that's time to go to the ER. But just generally getting a tiny little bit breathy, that's what I'm talking about here. And then a cognitive fog. There's debate on whether or not that's a symptom of MG, but it's subjectively reported enough that I want to put it on this slide. So it's different for everyone. Me personally, I know that my specific fatigue signs, if I start overdoing it, is I start feeling it in my mouth. I will have trouble forming my words. I will have fatigue in the lips and in the tongue. So I'll start slurring. So my T's and my S's will start going. I will feel my face it almost feels like it's drooping or melting. I will get more noticeable eyelid droop. And then I'll start feeling it in my shoulders and in my hips. So that's my personal fatigue signs. But so the key is, right, you want to know what your fatigue signs are and then hone in on them, and be aware that if you start feeling those increase in symptoms, that's a sign you're going into energy overdraft. You also want to make sure you're setting very realistic goals with the tasks and the activities you do. So you want to make sure you're prioritizing your tasks, and we'll talk about that in a little bit. You want to break your tasks down into very manageable steps, and then you want to set, and most importantly, honor your boundaries. So if you have, for example, time limits. So for me on my workday, I end my workday at 3 o'clock, and that is a hard boundary for me, because I know after 3 o'clock, I'm starting to turn into a puddle of goo. And I learned the hard way that if I don't honor that boundary, I'm going to pay for it. So set boundaries, but honor those boundaries too. Traffic light. This is another framework that I use a lot. And it's a way of checking in with how you're feeling, how your energy is doing. So traffic light, you have green, yellow, and red. Green is where you're not feeling any of those increased fatigue signs that I just spoke of. Green is you're feeling good, and you can keep doing whatever activity it is you're doing. But there's always a but. you want to keep checking in with yourself. You want to keep paying attention to what your body is doing, because just as you're driving down the road, if you look up and you see a green light, you know that you can keep going, but that light is not going to stay green forever. So you don't just check the light, say it's green, and then whew, keep going, because eventually that light will turn yellow. And if you're not checking on it, you won't see it. So green is keep going, but check in. Yellow is where you slow down. So yellow is where you start to feel those initial increase in fatigue signs. So that might be whatever that is for you, whatever you have identified as your typical fatigue signs. That's your body saying, hey, doing too much. We need to stop. We need to draw back. So, and then red is, and I'm hoping the idea is never to get to red, but red is if you keep pushing through those, through yellow. And red is where you are going into a flare. You're going to go into an exacerbation. You are wiped out for 3 days because you kept going past yellow. So people ask me all the time, what's the difference between yellow and red? The biggest difference is that you have a choice at yellow. You have no choice at red. So at yellow, you start to feel fatigue signs, but you have the choice of whether you stop or whether you keep going. At red, your body is going to make the decision for you. That is where that muscle is going to give out. There is no pushing forward. You're a pile of spaghetti on the floor. You're done. So that's the difference there. I use this framework with myself. I use this with my clients all the time. And this is how I check in. Okay, where are we? Are we green? Are we yellow? If we're yellow, we're stopping, we're taking a break. We're paring down activity. So a really, really great way to think about it. Get a picture of a traffic light, post it up where you function the most, where you spend the most time. And as a reminder to check in with how you're feeling in terms of the activities you're doing. The Pomodoro Technique. So this one, I love this technique. It was not developed for chronic illness at all. This was developed by, I'm going to butcher this name too, but Francesco Cirillo, and it was designed as a work productivity technique. So the idea is that you take a timer, and I actually have one on my desk. I have a Star Wars R2-D2 kitchen timer, and that's what I use, or I'll use a timer on my phone. And I will set a timer for 20 to 25 minutes, just depending on what I'm doing. When the timer goes, and during that time, I do whatever task, whatever activity it is that I have set out to do. When the timer goes off, I take a break. So this is really great because this is a technique. You're already in the green, referencing back to my stoplight analogy. You're already in the green. And you set yourself a timer, so 20, 25 minutes. And now you don't have to think about, okay, I know I need to stop at some point and take a break. You just get to do what you're doing. The timer is going to take care of that for you. So the timer is going to say, hey, it's been 20 minutes, take a break. And ideally, you're still green at this point. And so you take a break before your body tells you need to. And the idea about doing that is that it keeps you in the green. So you take a break for 5 to 10 minutes. And I'm using a range here because it depends on the activity you're doing. If it's a little bit more strenuous activity, I would advise shorter activity time, so 20 minutes, and then extend the break to 10. If it's a task that's, for example, if I'm doing paperwork at the desk or something like that, that's not that labor intensive, I will set a longer timer. I'll do 25 minutes of work or activity and then a 5-minute rest break, but modify it based on what you need. So you take your break, and the key is there, actually take a break, please. So that doesn't mean stop and then go do a different activity. That means stop and actually take a break. So whether that means I might, so I have an office chair, for example, that's fully supportive up here in the head and neck, and it can recline. I can do that. I can recline. I can close my eyes, rest my face, rest my neck, rest my trunk. I might put on some music. I'll set my timer for 5 to 10 minutes and take the break. And then after that, I come back and resume activity. And I do this again for three or four times. So again, the Pomodoro Technique was not developed for chronic illness, but I think it really, really works. And it helps it takes the pressure off of oh, I know I need to take a break, but then, right, we get into doing what we're doing and we get going and lose track of time. And then the next thing I know, I'm at a yellow light. I'm feeling symptoms and then I'm having to take a break versus something like this keeps me in the green all the time. So I find this to be a really, really helpful technique. And one of my biggest thing is make friends with your calendar. So a calendar activity, and I put this particular graphic on here because it has the hours out throughout the day. Um, it's easy to think about your day and think about, oh, okay, I only have 3 or 4 things in my day. It's not that overloaded. But when you actually put it down on a calendar and you actually put or on a daily schedule and you see the amount of time that you have committed or the amount of activities that you have committed to, it changes and it allows you to see a lot of things. So I always recommend using some sort of a planner that has the hours. And let's see if I can mark up the slide. Hopefully it lets me. So we're gonna make this red. Okay, great. You want to, first of all, you want to know what your peak hours are. And it's different for everyone. So I'm going to share with you what mine are. So I am a morning person, always have been. So I get up in the morning, and by the time I've taken my first my general medication and my first medicine on, that takes about an hour, and I still have to get ready and everything. But I know that generally for work or other type activities, I'm usually ready to go by about 9 o'clock, and I do my best work between 9 and 11. That is my peak. That's when I'm at my best. After that, and in the afternoon, I start going down. And I also know that by 3 o'clock in the afternoon, I need to be resting. That's my rest time. Some people are different. Some people have a harder time getting going in the morning, but they hit that stride by about 1, 2 o'clock in the afternoon. And that's their peak time. So you really want to know what your peak time is. And then when you're scheduling activities on your calendar, you want to schedule activities according to where your peak times are. So peak time is, right, your general, are you a morning person? Are you an afternoon person? But then also think about your medication schedule too. When is your medication at its max effect? So if you, for example, take Mestinon periodically throughout your day, if it's the quick acting Mestinon, it's effective after about 30 or so minutes after taking it. So if you have activities that are a little bit more strenuous, you want to think about your Mestinon schedule as you schedule those activities, depending on how much control you have of your schedule. So for example, like I said, 9 o'clock is really where I will want to start my day. And I know that by 3 o'clock, that's where my workday needs to be done. And then I will put down all of my appointments. So I use an electronic calendar for this that does the block scheduling. But I want to make sure, right, that I prioritize my tasks and I put my heaviest tasks up here when I'm feeling my best. It's also important to pace and space. So if I say, okay, I've got 3 things I need to do and they're all strenuous, I'm going to put them between 9 and 12. Well, there's no space there. And I can visually see that because I have put it on a calendar. So I can then go in and say, okay, well, what's the priority here? What can I move around? Can I take away maybe that middle one and give myself a break in the middle? And it's a whole lot easier to see if you're looking at it in a grid format like this. So you want to pace and space, you want to plan for breaks, and I would argue schedule your breaks and call them whatever you need to call them to make yourself actually take them. But if you put it on your calendar and you block it, you're less likely to fill that time. You're less likely to fill that blank space on your calendar. So, and it also helps to offset if you've had a day that is a little bit more strenuous, you can block. So for example, if Monday, I had a whole lot going on Monday, I can take Tuesday and say, all right, I know that Tuesday I need to block that time because I need to rest. Everyone's different. I know different people have different amount of flexibility over their schedules, but just something to think about with that. All right, let me that. And then, so this is I'm going to have a little bit of fun with this one. So this is something I actually came up with as I was creating this presentation for this webinar today. So you guys are actually the first to hear this one. It's not even in my book. This is new. So I like to think about energy conservation and pacing in terms of the stop, drop, and roll framework. So if you are of a certain time, I don't know if the kids now are still learning stop, drop, and roll, but I think we all learned stop, drop, and roll. And so, hopefully no one's actually on fire. If you're actually on fire, do the whole stop, drop, and roll thing. But to think about it in terms of energy conservation, right? What can you stop? What can you drop? And what can you roll? So go with me on this one. Let's think about stop first. If activities and symptoms increase, or sorry, if you're doing an activity and you start having an increase in symptoms, stop. Okay. Take frequent breaks. So plan time to stop throughout your day. Plan your breaks, plan your stops. Stop feeling guilty for asking for help or canceling plans. I think every single person, myself included, needs this reminder because, we want to do everything for everyone and we don't want to let anyone down. But as the saying goes, you can't pour from an empty cup. And those who truly love you will understand why you need to set those boundaries and take care of yourself. And if you want to have the energy and be able to spend the time and do the activities that you want to do that are meaningful, you have to follow the energy conservation guidelines. So that means that occasionally you have to cancel those plans. You have to do that in order to have enough energy to be able to do the things that are meaningful for you. So this is your permission, if you need it, to stop feeling guilty for asking for help, for canceling plans. And then stop overextending yourself. And I say this as a kettle speaking to a pot. I'm bad at this. I am notorious for this. I will add things to the schedule. I will add things to the to-do list. I will overextend myself, and then I pay for it later. You'd think I would learn. I'm slowly learning, but stop overextending yourself and be very, very deliberate with what you put on your plate. So you have a limited amount of time of energy. You have a limited amount of space on your plate. And so make sure that the stuff that is on your plate is stuff that's meaningful for you. All right, drop. So drop unnecessary obligations from your calendar. So this goes back to where I was talking about prioritizing tasks. So if you have a list of things that you need to do, or a list of things that are on your to-do list, I would recommend prioritizing them. Okay, what's essential? What do I have to do? And then there's what do I want to do? And then there's the rest. And if there's any way to drop the rest, drop it. Drop it, delegate it, do something with it. But unnecessary obligations, drop them. Right? They're going to take your energy, and if it's not something that you need to do, and it's not even something that you want to do, drop it. And I'm going to say this, and I'm going to say this with, I'm going to put the liability tape in front of me. Do not actually physically drop yourself onto a chair. I only put this here to stay with my drop theme. It means sit. So, for activities that do not require you to actually stand or walk, save the energy in your legs and sit. So showering, if you have a shower bench, sit on it. If you don't have a bench in your shower, get one. Get a shower chair. Or if you have a tub shower, they have the little shower chair that'll help you slide into the tub. But sit while you're doing that activity. Save the energy in your legs for activities that actually require you to stand or walk. When you are at the counter in the bathroom, doing whichever activities that you do there, whether that's brushing your teeth, grooming, doing your hair, shaving, applying cosmetics, what have you, taking medication, there's no need to stand for that. So sit. I have chairs and bar stools strategically placed throughout my house so that I can sit. If I'm going to do laundry, I'm not going to stand at the washing machine and dryer. I mean, I'll do what has to be done there, right? To load the those machines. The name is escaping me. There we go, washer and dryer. But when it comes time to actually fold, I'm not going to stand and fold and do things there. I'm going to take that to where I can sit on the couch and have the basket in front of me and have a folding board or something like that in front of me. Anything I can do to make those tasks that I really don't want to be doing but need to get done more energy efficient. Kitchen, sit if you can. Sit in the kitchen for cooking, prepping, etc. Waiting in line. If you use a rolling walker that has a seat, like a rollator, it has a seat built in, so you get to a point, sit. Some people have, I talked to someone who carries a lightweight camping stool in a backpack, and if they're in line, they pop that camping stool out and sit and wait if they can. So that's an option there too, because prolonged standing will fatigue the hip muscles out pretty quick. So if you can save that energy, that is helpful. Drop, and again, I use the term drop. Don't actually drop items, please, but lower. Frequently used items to your counter level. So I know people will talk about, oh, don't have anything on your counters, but this is where we're not in a living magazine. We are not, that is not advice given for people living with chronic illness. If you have items that you frequently use, whether it's in your kitchen, in your bathroom, and if you want to avoid having to reach up or reach down, keep those items at counter level. So drop those items to counter level. For example, in the kitchen, I will use a stand mixer as an energy conservation tool. So I don't have to stir. I don't have to do, it has the food processor attachment. So I don't have to sit there and chop and do all of that. I save that energy in my arms. But the stand mixer is very, very heavy. And so if I followed the aesthetic of advice of having my clear counters, that would live in a cabinet. And then I would never use it because it's very heavy and I would have to lift it out of the cabinet, which would be very, very taxing. So I wouldn't use it, and then I would spend extra energy chopping, stirring, etc. So point being there, keep things on counter level. And then it's not so much an energy conservation thing, but I think we all, especially those of us who live in warmer parts, when the temperature is higher, we have less energy to spend because it seems to sap it out of us. So drop the temperature and you'll have more energy to spend. So that's drop. And then roll. I think I was hungry when I made the slide. I put a good cinnamon roll on there. Those do look good. But roll non-urgent tasks to the next day. So there's the saying, don't put off till tomorrow, or what you can do today, or some version of it. That again was not made for someone living with chronic illness. So if you go back to your calendar and you prioritize your tasks, and there's still things that they do need to get done, but they're not urgent, roll them to the next day, roll them to a day when you're not overloaded. Things with wheels, so rolling carts, laundry baskets that they're tall and they have wheels on them. Use things with wheels to help roll them around your house. It makes things a whole lot easier. So I have a utility cart and I will pack things up on it, and then I will roll the utility cart through my house so that I'm not lifting and carrying. And it's a whole lot easier. So use physics to your advantage. That's why we invented the wheel. So use it. Assistive devices, and I use that for roll because most of them have wheels. So walkers, rollators, wheelchairs, scooters, especially for longer distances. And I know that this can be a vanity issue for folks. I know it certainly was with me. But once I learned how much energy I was saving and how much more I could do by using an assistive device, it made all the difference. So and it doesn't mean that you always have to use a scooter or wheelchair, but if you want to be able to go to the shopping mall, or if you want to be able to go to the zoo or go to the aquarium, or do something that requires a lot more walking than you're used to doing, there's absolutely no shame at all in getting, and you can even rent them. a wheelchair or a scooter, because it's going to allow you to participate in that activity, be it with friends, with family, that wonderful, meaningful activity, without completely wiping you out. So it's absolutely worth it. And really, assistive devices are energy conservers at heart. That's what they do. So whether you're using a walker, you're basically distributing, you're taking more weight through the device and through your arms and through your trunk by using a walker, and you're saving the energy in your legs. By using a walker, the muscles in the front of your legs, the hip flexors that help advance your limb forward as you walk. Basically, you offload with the walker, and you let gravity bring your leg forward. So you're saving energy in those hip flexors, and that's how that works. That's how that's helpful. Crutches, for example, if you have more fatigue and weakness in the back of your hips and the hip extensors, or the glutes, or the butt, for lack of a professional term there, just so you know where I'm talking, those are the muscles that help to push you forward as you're walking. And so using crutches can help propel, so you can use basically your arms, your triceps, and your lats, which tend to be a little less affected in MG. You offload onto those muscles to give your hips a break. So that is how those devices help energy conserve. And then, of course, wheelchairs and scooters, you're helping basically preserve the leg muscles almost entirely. So use them, conserve your energy, and actually enjoy the activity you're doing, rather than spending all your energy trying to taxing out your leg muscles. And then roll with your body. And this is a hard lesson too. Roll with your body, because your MG is a moving target, and we're going to feel different ways each day. And depending on whatever treatment regimens you're on, if you have ones that perhaps have a 3-week, 4-week course, sometimes by the end of the off period, right, you might be feeling effects a little bit more while you're waiting for the next dose. Or if you overdo it one day, you need to take it a little easier on your body the next. So roll with your body. And I think a lot of times it's easy to antagonize our bodies, or view our bodies as the antagonist, right? Because it doesn't function like it did before I had MG. But I think it's also important to kind of change that framework, that mental framework. Our bodies are working really, really hard for us under less than ideal circumstances. And to give your body a little bit of grace. It's working really hard for you. So roll with your body, pay attention to how you feel, and modify accordingly, and don't be afraid to do so. So also roll with yourself and give yourself some grace too. You're working really hard too, under less than ideal circumstances. So roll. So let's stop, drop, and roll. So take home points, right? You want to use energy conservation strategies to manage your daily activities. The idea is to spend less energy on just those daily activities that have to get done, so that you have more energy left over for activities that are fun, that are meaningful, that you are passionate about. So kind of going back to that example of when I had that conversation with my doctor, do you want to spend your energy walking across a parking lot, or spending time with your daughter? Which one's more important to you? Well, my daughter. Okay, well then use the handicap placard and park closer and save that energy. You want to apply pacing and spacing to your daily schedule. Make friends with your calendar. I recommend using the daily calendar that has the hours spelled out, so you can see your day in block format, and see, are your activities paced? Are they spaced? Do you have breaks? Are they scheduled at your peak times? You want to be mindful of your limits, adjust your routines as needed, and think about, right, what can you stop? What can you drop? What can you roll? Right. So I will open up for questions. Before I do, though, I'm going to put this slide up. This is my contact information. Please feel free to reach out. Email address is on there. That's liz@mgphysio.net. I do get a lot of emails, so please be patient with me, but I will get back to you. Also, please follow me on social. I post stuff like this all the time. You can find me as the Myasthenic PT. I am also on LinkedIn, strictly speaking, but you do better to find me either on Facebook or Instagram.
Thank you so much. Lots of great information, and we have some questions that have come in. So the first one is, any suggestions about exercising and conditioning?
So that is a very, very large and broad topic. And it is absolutely different for everyone. The first thing I will say about exercise is that, and I say exercise and activity. Sometimes I say the word exercise, and that's a fear-inducing word, because sometimes we say exercise and I'm thinking of weightlifting and pumping iron in the gym and running a marathon. And exercise can be walking the dog. Exercise can be, doing uh, activities in my chair. It could be gardening. It can be lots of things. So, but the biggest thing is that there are lots of health benefits to exercise, and there are lots of basically reasons that research shows us why we need to exercise. With MG, it's different though. And so it's not that we can't exercise, it's that we have to be very strategic about how we exercise. And a lot of the general exercise guidelines do not apply in MG, and we need to modify it. It's a very, I'm hesitant to give kind of overarching advice because it is very different for everyone. And this is certainly something I would recommend talking to your healthcare provider about. I know I sound a little bit like the beginning warning on the exercise videos. It says, please consult your doctor before proceeding. But that being said, right, just because everyone's in a different place. But if I were to give any guidelines, it's start ridiculously low. So start with something you absolutely know that you can handle in terms of activity. That might be walking a lap around your dining room table. That might be walking to the mailbox. It depends on where you are. So start very, very low. And then you want to progress very, very slowly. You want to take lots and lots and lots of breaks, whether you feel you need them or not. And that's where a timer comes in very, very handy. And you want to keep the temperature low so you want to make sure you do not overheat. And you do not necessarily need equipment or anything like that. Again, everyone's in a different spot. There are some of us who can work out with equipment, but you don't need to. You can get a great exercise routine just by moving against gravity. But so those are some general guidelines. Beyond that, I would say that would require an individual consultation with your healthcare provider.
Thank you. This next one is, what might we do to increase our fatigue limits over time?
So increasing your fatigue limits over time. So that comes back, actually, that follows right on that exercise question. So that was strategic. Well done. So over time, and there are some good studies that are coming out now to show that we can, with MG, we can actually increase our strength, we can increase our stamina, we can increase our endurance. But it is that you want to start low and you want to progress very, very slowly over time, and you will find that as the muscle gains strength and power and endurance, which it can, again, research has shown us. There's a really, really good study that actually showed the muscle fibers. They did ultrasound study on the muscle fibers, and over a 6-month period, they actually did show MG affected muscles gaining girth. So we have research to support that we can gain strength. We just have to be very strategic about it. But start low, go slow, be patient over time, and also keep in mind that fatigue level is a moving target. So from day to day, you might fatigue at different levels, and it really is important to check in on what you're feeling and where you're feeling, because what you're capable of one day, the next day you may not be capable of that same amount of activity, and that doesn't mean you necessarily got worse. That just means it's a bit of a moving target. But the idea is that slowly over time we increase that threshold. So even though you're still bouncing up and down, that threshold is higher. So your bad days here are better than your good days used to be.
This question kind of follows along this line of thinking as well. How can I tell MG weakness from deconditioning from having to rest so much?
That is a very, very good question, and it's actually one that I answer a lot. The first thing is that it can be very hard to distinguish between the two of them, but the best way to distinguish, just because there's so much overlap, MG weakness is if it fluctuates. So a muscle may start out as strong and you use it over time, and then you use it a couple of repetitions, maybe just depending on the muscle and what you're doing. And then you'll notice that strength rapidly drops in that muscle that's affected by MG. In deconditioning, or a muscle that is truly weak, it's going to be weak to start with across the board. So you're not going to get, it might get a little bit better with rest, but you're not going to see that drastic change that you would see in an MG muscle. So if you have a muscle that is truly weak and deconditioned and atrophied, you're not going to have a lot of strength in it to begin with. In an MG affected muscle, you may have strength in it to begin with, but with use, that strength is going to rapidly decrease. And that's how you tell the difference.
Thank you. This one is, I do a lot of public speaking and find that my voice volume and quality changes after a short while. Have you any suggestions for this?
Yes, I do. I also do a lot of public speaking, and I understand that. So that is where I talked about setting or knowing what your peak hours are. And if you, depending on how much control you have over your schedule, but making sure that you are timing your speaking engagements either with your medication or when you are generally at your best. And so, for example, I'm going to use this particular presentation as an example. When I was asked for my time when I would do it, I get pitched a couple of times, but I said that I would start it no later than 2 o'clock, because I knew that if I started it at 3 or 4 o'clock, I wasn't going to have the voice and the diaphragm to be able to give this presentation. So it's that knowing your limits and respecting your limits. I would also recommend, depending on the nature of your engagements, if you have to speak a lot in a day, make sure that you've spaced them out and that you are giving yourself adequate rest between. And then, so I would use the calendar really with that. So to sum that up, plan your speaking engagements in accordance with your peak hours. So when you generally feel your best, that's when you want to try and plan those engagements. And know when you know your limits. So know that, okay, I can only speak X number of hours a day and don't go over it. Give yourself breaks and rest and build that into your schedule, and do not go past your basically your ending hour. So for me, it's 3 o'clock Eastern. That's my ending hour. That's when my voice is done. And I know that I can probably speak for about 4 hours in a day before my face starts melting. But that's me.
There's kind of a bunch of different questions around PT. How do you find one that specializes in MG? And then along those lines, what tips can you give for convincing your doctor to refer you to a PT? Are there any specific words you can share with your PT that are better for them to understand than saying, I get tired? How can you help your PT understand what you need help with?
Okay, perfect. I will do my best to address that, although I could probably give an entire talk on that alone. But I will do my best to nutshell this one. So PT is a very, very broad profession. So as I said in the beginning, I started out as very orthopedic, and now I am much more neurologic. So just as physicians have specialties, so do PTs. So just as, for example, you wouldn't necessarily go to your cardiologist to discuss your MG. Same thing is we have orthopedic physical therapists, we have neurologic physical therapists, pediatric physical therapists, men's and women's health, geriatric, neonatal. They're across the board. They're everywhere, and there's new specialties all the time. So especially now that most PTs carry a doctorate, and most PTs are now carrying some sort of a residency and specialty as well. My recommendation is that you find and there are entire practices too that are built around neurologic PT. So that would be my first thing, is to find someone who is a neurologic PT. And just keep in mind that a lot of the strip center PT clinics, the ones that you kind of find in shopping malls, those are generally speaking general and orthopedic PT clinics. So you may not find someone who really understands MG. Now, in terms of someone who specializes in MG, that's going to be rare to find, because MG is such a rare disorder. I personally kind of broke the mold when I did that, at least to my knowledge. That's not to say that there aren't good PTs who understand MG. And if they haven't necessarily worked so much with MG, you want to find one who's worked with conditions that are similar to. So ALS, Guillain-Barré, MS, lupus, those family of conditions where we have to energy conserve, they're going to understand that a little bit better, as opposed to the other side of neurology or neurologic PT, which is dealing a lot more with spinal cord and stroke and Parkinson's. So that would be part of my interview process. If I'm looking for a PT, is okay, you may not have worked with too many MG folks, but can you work with MS? Can you work with Guillain-Barré? Can you work with ALS? If they understand those, you're in a much better position there. In terms of communicating with your PT, oh no, sorry, there was a question about how do I get my doc to write me a referral? I'm going to say this with as much diplomacy as I can. I absolutely believe that we need to make, good interdisciplinary communication, interprofessional communication. That being said, in the United States, and every single state has some degree of direct access to physical therapy. In every single state in the US, you can at least go for an evaluation. And in many states, you can initiate PT treatment without having a referral from a physician. Depending on the state requirements, then they'll start communicating and everything like that. But if you want to go, you can go. It used to be, if you'd asked me that question 20 years ago, my answer would be different. But in every state in the US, you don't need a referral to go to PT, at least to get started. And the last question is communicating with your PT. And so, more than just tired. So first of all, communicating is the key there, because a PT is going to watch you for certain signs while you're doing activity. So for example, when I'm working with my clients, I'm looking for things such as I'm watching for compensations. I'm watching for them to stop using the muscle I want them using and to start using extra muscles, which means that muscle's fatigued and we need to stop that activity. I'm looking for that. I'm looking for signs of breathiness. I'm looking for shuffling in the gait. I'm looking for changes in posture. That being said, I can't feel what you feel. So you have to communicate that. If you start noticing your fatigue signs, and I communicate those up front, right? These are my MG fatigue signs. I get increased double vision. I start slurring. I start doing XYZ. If you start feeling those, even if you're in the middle of a set, if they give you 10 to do, for example, because I swear PTs, we only count to 10. If we want to count higher, we count in 2 sets of 10, 3 sets of 10, but that's what we do. We count to 10. You're in the middle of a set of 10, you get to number 7 and you're starting to feel signs, stop and say, hey, I'm starting to feel my fatigue signs. The other thing that I do a lot, and you're going to notice that most PTs and most healthcare providers too, are going to ask you, what's your pain on a scale of 0 to 10? That's a very standard question across the board. Most insurances require us to ask that question, and that's why it's asked, even though MG is not a painful condition as a primary symptom. I can get into that another day about secondary and tertiary pain with MG, but that's talk for another day. But that's not our primary thing. Our primary thing is weakness and fatigue and changes in the way we move. So I recommend setting up a different question. So I communicate based on energy level. Where is my energy level today? 0, I have no energy at all, and I'm a pile of noodles on the floor, barely breathing. And 10 is I'm not going to PT today because I'm going to go hike Mount Kilimanjaro. So that's my 0 to 10. So where am I today? Today I'm a 6. Today, or if I'm saying, you know what? All right, I was a 6. Doc, now I'm a 4. Now I'm a 3. That is how I would communicate that. or recommend that, but definitely communicate and ask basically how the PT wants you to communicate what you're feeling with them.
Thank you.
I could go on all day about that, so I'm going to stop right here.
That's great. No, thank you so much. Well, we're at the top of the hour now. I see that there's still some questions that we haven't had a chance to answer live, but we'll be sure to follow up. Liz, this has been such a great topic and there's so much interest in it. So we thank you so much for taking the time to present it. And
Thank you for having me.
and I hope that everybody has a great rest of their day and we'll see you soon. Take care.